Hello viewers, you're watching Doordarshan Kendra Kohima. Welcome to another episode of Talk and Know, a show where we discuss topics that matter. In this episode, we will be dwelling on an issue that concerns all of us. As I speak, the global population has surpassed 8.2 billion, and India now ranks as the most populous country with 1.47 billion, surpassing that of China, which stands at 1.42 billion. These numbers remind us why it's important to talk about population growth, because it affects every part of our lives, from food, water, to health, education, and environment. So in this episode, I'm joined by experts who will help us understand what these numbers mean to us and what challenges we face, also what steps can be taken to ensure a healthy and balanced future for everyone. So joining me on the panel, we have Dr. Khevilhu Nakro. He's the District Program Officer of Kohima. We also have Ms. Vingosanyo Katso, the Program Officer from the Family Planning Association of India. So thank you very much both for joining me. We look forward to a conversation where our viewers will benefit from an issue that concerns all of us. I'd like to start with Ms. Vingosanyo. This year, as usual, the World Population Day was observed on July 11, where an interesting theme was picked up for this year. This year, the theme was to empower young people to create the families they want in a fair and hopeful world. Now, on this theme, can you take us to understand why a theme like this is important, particularly as the population grows, and what significance it has for a state like Nagaland?
I think this year's theme really aligns with the young people of Nagaland, and especially we see that a lot of times young people, they do not get the proper information or support, and when you talk topics like contraceptives or reproductive health or even relationships, these are not often talked about or openly talked about. So even if they have a question, they have a query, they're often hesitant and they take a step back. So I think this year's themes really aligns with the young people of Nagaland. We see that in a lot of times the young people do not get the proper information and support. And when you talk about topics related to contraceptives, reproductive health, or even relationships, a lot of the times these topics are not openly discussed. So when these topics are not openly discussed, they are hesitant to even ask questions. So because of this, we can also see that because of the silent treatment, we see that we see cases of unplanned pregnancies, we see early marriages, and even poor health outcomes. So this year teams breaks the silence paves a way to break this silence, so that we give a way for the young people to give them with the correct tools, equip them with the tools so that they can be informed about their choices, about their bodies, their rights. And when I say talking about making their own decisions, I don't mean them going and making their decisions in isolation or rather stop discarding the advices of the elders, but rather making sure that if they're informed, they'll be able to make conscious decisions, as well as keeping in mind the respect for the family and values as well.
Okay. And on that aspect, Doctor, I'm coming to you. If you could tell us, what are programs that are running in the state, and why these programs are significant for us?
Right now, for population programs, we have Mission Parivar Vikas, and also we have Sarthi on Wheels and World Population Day or World Population Fortnight, which is being carried out every year in the month of July. This World Population Day, in our context for the districts of Kohima and also for the states of Nagaland, this is very important because it is always good to know about the family planning methods, and awareness and sensitization is very important even in today's world. With this huge population, still to have a healthy life for both the mother and the child, it is important to know the family planning methods and the birth spacing, which we are focusing this time. And so birth spacing for the families, this is very important. Every family has to learn what are the methods and how well they can establish their family. And Mission Parivar Vikas, here in this program we have Naya Pehli. So the newlyweds are being sensitized, they are being given awareness about family planning methods. So this is a good program that is going on. And Sati on Wheels, this was also recently launched all over India. And here the program, how we conduct the program is that we go on a mobile basis, going to different places, villages, or to the urban colonies where these facilities, health facilities are not available. So there, miking is done, awareness and sensitization of these family planning methods are being imparted.
Okay.
So these are the few programs that are going on, and on top of that, we have these health melas, health camps for all other programs. But during those camps, those health melas and those health camps, we have family planning component is always there. And this we have RCH camp, reproductive and child health camp, which are being conducted yearly, and on all those camps we have this family planning component. So these are few programs that are going on.
Thank you, Doctor, for letting us know about the programs. Also, on that aspect, if you could tell us what are key activities that you organize, especially during the World Population Day and during the World Population Fortnight.
During this World Population Fortnight, we have some activities that are being carried out. Prior to the implementation of the program, we have this sensitization and awareness program that is going on. That will continue for about a week. And here we have focal group discussions, where eligible couples, usually the female 18 to 49 years of age, they are called in groups of 10 to 15, and then we have these discussions like what are the benefits of family planning. They are being sensitized on that. That is one. And after that, a real activity comes into play, whereby this for them to decide what family planning methods they want to take. Like we have permanent method of family planning. So those are being imparted to them, the knowledge. And then we have temporary methods. So where they can avail these services and what time they can avail and whom to approach. Those are the things that are being imparted to them during these focal group discussions. And after that, the real activity are being conducted in the health units. For permanent methods, usually the district hospitals, or as for us in our context, it is Naga Hospital Kohima, and also in community health center where there is a gynecologist, this can be conducted. Whereas for temporary methods, it is being given, the services are being given, provided in the community health centers and primary health centers, and also in some sub-centers where the nurses are trained. So these are the activities that we go about.
Okay. Ms. Vingosanya, if you could also take us through the services that the FPA, the Family Planning Association of India, through your organization, initiates here in the state. Also, if you'd like to focus on Kohima district.
Sure. In our organization, we are providing different services. You can be counseling, HIV, STI, screening and counseling as well. We're also providing mental health awareness, adolescent-related issues. It could be menstrual health problems. We're also providing lab tests as well. Besides that, we're also giving free cervical and breast cancer screening. These are some of the services that we're providing. It's available all throughout this year, not just for this World Population Day, but it's available all throughout the year. So anyone who wants to come and avail these services, we encourage them to come and avail these services and also seek these informations as well.
Do you also have like a particular target or focus group where you have some services targeted to adolescents, to women, or the marginalized groups as such?
In FPAI, what we do is we try our level best not to leave out anyone. So what we do is sometimes besides the clinic, we do provide outreach health services. So we try to reach out to places, rural areas where they do not have basic health services. It could be a PHC, a primary health care. So we try to reach out to those, not only rural areas, but we also try to reach out to even colonies as well, or for people who have difficulty in accessing this service. We try to reach out to them, and we also closely work with ASHA workers, so they help us in identifying and mobilizing as well. So overall, our goal here is that the women, the girls, adolescents get the support and the care that they need.
Now I'm just curious because one is a non-governmental organization and the other one, doctor, is under the CMO of the district. Sometimes do you collaborate, or sometimes do you see an overlap? This is just out of curiosity, if you could take my question, doctor.
Yes, there is no overlapping
Okay.
here. We work together hand in hand. In fact, Family Planning Association of India, based in Kohima, there have been a strong backbone for this program.
Okay.
They are here to support us in all those places where our health units cannot go. So we are very thankful to them for their activities. And as for us, we have no problem working with anybody as long as the guideline is being followed.
Okay. And you know, our society is more of a welfare-oriented society. So when it comes to looking at a government service, we tend to depend more on government services as well. In this regard, doctor, particularly because you cover the district of Kohima, are there any key areas or priority areas in the district that you target, that you look out to?
Regarding this family planning, for this program, we don't have any specific areas, or we don't give any importance to a particular area.
Okay.
In fact, we try to cover as much as possible regarding sensitization and awareness, so that anybody, after getting those information, if they are willing to come for these services, they are being given. So we don't have a particular area or a particular village like that, but we have our programs, monthly programs like Village Health Sanitation Nutrition Days or Urban Health Nutrition Days, where these family planning talks are also being given. So our target is every person, eligible couple, should be aware of this family planning method. That is our target, no specific.
Okay, okay. And Ms. Vimosanyo, coming to you, you've mentioned how you take help of the local people, the ASHA workers also. You know, how important is the role of peer educators also, and taking the help of such local workers who knows the community actually very well in providing the services that you give it to the people?
Besides ASHA workers, we also have, in our organizations, we have youths, young people who are voluntarily working with our organizations. So they help us in organizing a session, be it spreading awareness, or even conducting a program known as CSE, Comprehensive Sexuality Education. So here they play a very important role. Why? Because they themselves, being as young people, they can relate to the young people as well. And then we are able to identify how to really approach them and what they're in need of. So our organization, being a volunteer organization, we're really grateful to these volunteers for the time and commitment they give, not only to our organization but to the community as well.
And I know you've mentioned the comprehensive sexuality education. Usually in our society we also not very much talk about such topics. How are such conversations taken, especially when your youth volunteers reaches out to the targeted group of people?
Before I begin this, go to the question, I want to explain what exactly CSE is all about.
Please.
So, Comprehensive Sexuality Education is a program for young people where we discuss topics such as relationships, their consent, bullying, or violence. These are things that, as they enter into adolescence or youths, they are most likely to face. And if they are not guided well, they are most likely to be misled. So, in our organization, we try to organize or take these sessions to the young people. Talking about CSE, coming back to CSE, we see that sometimes it's misunderstood. A lot of people, we have come across situations where people think CSE is not that important, or things like CSE topics, related topics, can wait a little bit. But they think that the education they're getting, that is enough. So like these topics should not be that prioritized. But we have also come across schools and teachers who have warmly welcomed us when we have approached them. And we also see that due to the ongoing activities, a lot of activities are happening in and around the schools, and we really appreciate that. But because of these activities, sometimes CSE is also not given the priority it needs to be prioritized.
Doctor, I'd like to know your view in that regard. I see you nodding here. If you could share your view.
Regarding CSE?
Yes.
Actually, that is a different thing to discuss, but still then, yes, to know about their sexual health. This is very important, especially for adolescents. And as they grow up, So it is not just for the young girls, it is also for the eligible couples. Where eligible couples means we take the female age from 18 to 49, but then the male counterpart is also should be aware so that they have a good and healthy family. Because without knowing, sometimes knowingly or unknowingly, many diseases are being infected. So it is always good to know about these programs.
So when it comes to sensitizing people, especially on sensitive topics like this also, how do you consider the cultural sensitivity of the people when providing such services?
Here we have, in some health units, not in all, we have counselors. So we have counselors who give counseling, but of course the turnout is also not that much, but then we have counselors who are trained on these things. They are given health talks on STIs, they are given health talks on sexual health, and so the health department is also doing their part on that.
Okay. And Ms. Vingosanya, I'd like to know your perspective in this regard. What challenges you face, especially when it comes to providing these services, reaching out to people, because you also mentioned this are challenging and often considered taboo when it comes to talking about contraception or maybe reproductive health. So what are challenges, especially for an organization that very closely involves with the community?
Well, one of the challenges would be when you talk about topics such as contraceptives, reproductive health, these are still not openly talked about. So when you talk about this, people are often hesitant, or it's not that they don't agree with us, it's just that we have been brought up in such a society where we don't openly talk about it. And when you talk about the young people regarding contraceptives, here we're not encouraging the young people to be sexually active, but whether if they're well informed, even in cases where they have to make a choice, if they're well informed, they can make informed choices and make choices that are responsible. So this way we can reduce unplanned pregnancies, reach the reduce of early marriages, and even most importantly, they can take control of their health and future as well.
And how do you build that trust with people, asking them, because building trust would be a different challenge in itself. How do you build that trust with the people to avail your services?
Whenever we conduct outreach health camps, what we do is, before we begin with basic health checkups, what we do is we try to gather the people so that we try to conduct an awareness session so that they know what we are actually doing, what they can expect from us. So I think by doing this, I think they get it makes it clear for them what they can expect from us, and then I think this builds a way for them to trust us.
Okay. Thanks for sharing. Also on the government sector aspect, I'd like to know, Doctor, what are challenges that you face, especially in implementing such population-related programs?
Challenges as such, it differs from place to place, but still, as family planning, DPO has also highlighted, actually sensitizing the people about these family planning methods and the logistics that are being provided by the government and agencies. These are very important. If we give proper sensitization and awareness on this family planning, all challenges are being overcome. But then the real problem is that ignorance and then failure on our part to reach out to each and every individual. So as discussed earlier, we have these focal group discussions, not too many groups, but then 10 to 15 beneficiaries in one group, and then in a small group, so that they come forward, they are ready to interact, and interpersonal communication, like one-to-one interactions are also being given during this fortnight. So the challenges are there, but with this sensitization and awareness, these are overcome.
And I'm curious to know, how do you measure successes of such programs that are implemented?
That's a very good question. See, as talked earlier, with this implementing of this program, family planning program, the success of this fortnight or what family planning program is going on can be measured only through the outcome. Like how many people have come forward for focal group discussions, the number of beneficiaries, those who are willing to come and listen to the sensitization program and awareness program that is being conducted, and also the numbers of tubectomy, vasectomy, that is permanent methods that are being conducted in the facility during this program, and also injectable MVS. So only through these programs like copper T insertion, the numbers of tubectomy, vasectomy, copper T insertions and injection MVA, which are being conducted in the health facilities, from taking from district hospital to community health center to PHC to sub-center, how many total number availed. Basing on this outcome only we can come to a conclusion whether this has become a success or not.
I'd like to interrupt you there a little.
Okay.
If you could tell us what does those kind of methods mean? Because those are medical jargons that me and a lot of our viewers might not understand. So if you could break it down for us.
These permanent methods are those family planning methods where this, if one couple opts to have a permanent method of family planning, then tubectomy is done for females and vasectomy for males. Of course, and then after that, they will not be able to conceive again after this permanent method has been taken. And whereas temporary methods like copper T insertions, which may be for 5 years or 10 years, after removal of copper T, then they can have their family again, like they can conceive again, they can plan. And like that, likewise, we have oral contraceptive pills, we have condoms. Those are also there in temporary methods. So they can opt according to their choice.
Okay. Okay. Ms. Vimosan, coming to you now. If you could also share, how the FPAI ensures and creates a safe environment, especially for the young people to come and avail your services.
In our clinic, we try to, our main priority is privacy. Our staffs here are well trained, making sure that they maintain confidentiality, and when they provide services, they maintain a non-judgmental attitude. So anyone, not just young people, anyone who comes to avail the services in our clinic, we make sure that privacy is maintained. Anyone who wants to come and avail these services, we make sure that they get the right care and support that they need.
Would you have any success stories to share? Any positive changes that you that has been made through your intervention, and if you'd like to share it with us?
One of the impact of our organization would be conducting CSE out of schools, that is outside of schools.
Okay.
So we have a program known as TOPEX. So TOPEX is a program for young people where they can come and showcase their talents, be it singing, dancing, or any forms of art. So what we do here is whenever we have this entertainment session, in between we take a short session, awareness session related to the CSE topics, be it relationship, violence, or anything, bullying, related to anything. We try to incorporate those awareness sessions even during this entertainment session. So it's a mixture of both fun and learning. So here, over the years, what we have seen is we have seen the people, the youths, the young people evolve, becoming more confident, more expressive, and also more open to learning.
Okay. Doctor, coming to you, if you could share, how do you plan to keep the momentum going, particularly on family planning program initiatives in the state beyond the World Population Day and the fortnight?
Regarding this population fortnight, it is only a special program that is being carried out during the month of July, usually. But then, as a department, Government of Nagaland, Health and Family Welfare Department, we have continuous health talks activities which are being carried out during these monthly village health sanitation nutrition days or urban health nutrition days. So there the health workers talk about family planning when they go for other services. Also, there is a family planning compensation for both tubectomy and vasectomy. Okay. So that is ongoing. Whoever is willing to come for tubectomy or vasectomy, they can avail the services from the district hospital or from Naga Hospital in our context. Okay. Also, we have a continuous training on this of the health staffs regarding family planning programs. So we are after this family planning fortnight also, this our continuous program that is going on in the district and in the state.
Okay. Thank you very much. Thank you both very much for sharing your insights into our discussions. Today's discussion was actually on global population uniting for a better tomorrow, and our emphasis was on Nagaland, particularly on Kohima district. And I hope just as much as I've learned, our viewers have also learned a lot. And like our panelists and our experts have shared, their services does not just end with the World Population Day or the World Population Fortnight. They are also available at the healthcare centers. The FPAI has their own centers here in Kohima and in other parts of the districts. So we hope through this conversation, more youth, more young people will also be more open to discussing an issue, a population growth issue that concerns each one of us. So I hope just as much as I've learned, you've learned, and thanks for tuning in. You're watching Doordarshan Kendra Kohima. I'm Madeline Yambrosia signing off from the studio here.